Hi there, I'm Kerry from the Nutritional Healing Center of Ann Arbor, and I'd like to show you a couple new tools that we're using in the office lately. These are great things that can help improve your health, and I just want to give you some tips on how to use them. Some of these came about because Dr. Schmidt did some great research, and he's got an excellent video on YouTube that is Collar Up Focal Infections Causing Systemic Disease. So a lot of the focus of some of these tools is from the collar up, so helping your immune system, helping with some symptoms you might be experiencing. One of the tools that I like to have in my house is this, just little bulb syringe to clean out the ears. So when I do that, or when I recommend that, I tell people to use 3% hydrogen peroxide. What I have people do, what I do, I lay down, I fill up my ear with the hydrogen peroxide, I let it bubble up, let it kind of hang out there for as long as I can, and then I use the bulb syringe. I draw warm water into the bulb syringe and flush that into my ear numerous times. Sometimes something will come out, sometimes it doesn't, but sometimes that will help relieve congestion, pressure in the ears, some of the things that can go on in the sinuses, the mastoid sinus here behind the ear. So I'd like to have this in my house, and always the 3% hydrogen peroxide too. We do tell patients as well, a lot of the supplements that we carry, some are in liquid form, so you can use some of these supplements in the ears and also behind the ears as well if you don't like the feeling of it in your ear, to help get at that sinus a little bit more efficiently as well. With the focus of that video, when Dr. Schmidt is talking, many of the recipes, or the main recipe does have to do with a water pick. So in that recipe, it is 12% food grade hydrogen peroxide with no stabilizers. We do have that in our office now. Adding in 1/8 of a teaspoon of a good quality fine grind salt, 1/4 teaspoon of sodium bicarbonate or potassium bicarbonate. This would be like baking soda. And you put that in the water in the reservoir of the water pick, and using that in the mouth to get at any bugs that potentially could be in the mouth and in the gums. You can use that 1 or 2 times a day before brushing. You could also make that into a gargle. So you could take that recipe, put it in a mason jar, and gargle with that if you don't have a water pick. But a water pick will get a little deeper into the tissue there too. Using a nebulizer. So we have a nebulizer that we carry in the office. I have this one that I have in my house. Using a nebulizer with a similar recipe. In my nebulizer, I just do the hydrogen peroxide and the water, and then you can breathe in that oxygenated recipe, that oxygenated healing liquid into your lungs, into your sinuses. This is great if you have a cough, if you have congestion, sinus trouble, postnasal drip. Sometimes I've done it when I have a headache, and it really helps to get the oxygen into the tissue. So a nebulizer is another great tool. The Navage, this is another kind of newer tool that we have in this office. So the Navage, similar to the idea of another tool, a neti pot, but using the Navage is going to actually get that fluid moving through, and it's drawing it out at the same time. So really good things to do with Navage. Sometimes you can just do it with the salt pots that come with it, but also putting some supplements into that water will get that supplement up into the sinuses, up into the tissue as well. So one that we like to do in there a lot is Para 3, just a couple drops in that Navage liquid. You can do a Navage with binders as well. So this is biotoxin binder, and kind of the most intense might be carboxy. So doing some of these binders up in the Navage can be great too. So using oxygen as a tool to help your body heal is one of the newer things that we found with some good success here in this office. I thank you for watching this video. I wish you good health, and if we can help you in any way, reach out. Thanks for watching.